theme of this conference actually is on implant dentistry, which is an emerging trend in replacement of teeth, and it actually involves metallic substances, especially titanium, that will be embedded into the alveolar bone, the bone of the jaws, to serve as roots. It will really act the function of the roots of the teeth that have been extracted. So in essence, the patient can chew and do whatever function, oral function, he or she wants to do with the implant replacement. And so we want to really let the public know that there's this new emerging trend of replacement of lost teeth and tissues.
Tooth loss is no longer like a death sentence, so people don't have to be afraid. And patients, you don't have to wait until like the last minute before doing it. Even before the tooth is extracted, and eventually it can be done. So come see your dentist. The treatment is planned out, and we'll be ready to attend to you.
Advice to the common man is to understand what implant is in the first place, that they can actually replace their teeth without destroying the other ones, and also is a permanent restoration. So you don't need to be removing it like if you have like when you have a removable partial denture. So if you understand that fact that you are going to have somebody that is permanent, that is easy to place, of course, if the people out there can be encouraged, although I know the financial aspect will be an issue, but that also comes with the role of the government. If the government can, give some incentives like insurance, at least insurance can cover parts of the cost of the implant, I'm sure a lot of people will be encouraged to actually place it. The failure rate is very low, talking about 6 point something to maybe 11.2%. So it's something that is encouraging to actually have.
Unless you make health insurance compulsory, then we will not be able to afford general health insurance, not to talk about the dental. Dentistry is an expensive discipline, health discipline, and unless you make it compulsory, the health insurance compulsory. When you make it compulsory, then health insurance is a game of numbers. Then you have the critical numbers, and then the affordability comes in.
There's no better advice you can give anyone than to tell them to keep the health of their teeth at 100%, because it has been research has shown over time that the health of the mouth is seriously linked to the health of the rest of the body.
To say the truth, implant dentistry or implant procedure actually costs quite a fortune, really. But if you compare how much it costs here in Nigeria to what obtains outside of the country, you want to have your implant placement done here. So yes, it's actually the most expensive replacement for teeth.
Implant dentistry is actually one of the latest innovations in dentistry, and if you're a dentist and not doing implants, then I would say that you're actually practicing the Stone Age dentistry. So implant dentistry is something that every dentist now should know how to do, because the world is revolving around implants now. A lot of people are opting to do implants. Everyone is going away from the bridges and dentures, and they want to do something more fixed.
Well, it won't have come at a better time, because that's what is in play now in foreign countries outside the world, in other parts of Nigeria. Unfortunately, it's not really, the awareness in Nigeria has not really been as it ought to be. So this is really a good time for this course and this topic for dentists as a whole in Nigeria to update our knowledge and practice about it.
We do implants in Lasot, but with this now would want to be encouraged. We even encourage our residents and others to sink more implants as we see our patients that need implants. We'll encourage the patients when we see them that it's good for them.
If a man loses a tooth, there are options to replace the tooth. He can have what we call artificial tooth denture, can have a bridge, and they can have an implant. Implant is the real replacement. If you have implant, it's almost equivalent to your normal tooth. You can enjoy your life in terms of appearance, in terms of using it to talk, to eat. You don't need to bother about removing it or anything. So it restores your function and your appearance.
A device, metallic device, that is placed into the jawbone of an individual in order to replace a missing tooth or missing teeth. And it's one of the newer options for tooth replacement. Conventionally, when an individual loses his or her teeth or tooth, the options we've had in times past have been things like dentures, that is the artificial tooth replacement that is removable, like plastic or false teeth. We've also had things like bridges and crowns, which we are still utilizing now. But dental implants, the beautiful thing about it is that it's a fixed, like a more permanent restoration, which would help to replace the patient's tooth and improve aesthetics. Cost may be a challenge, but it's something that is available. So the common man should know that they don't have to travel abroad to have dental implants fitted. There are no side effects. If it's done, well, there are side effects to every surgical procedure, but there are no real side effects because the material that is used, which is titanium, is compatible with the body.
We actually have a very few number of periodontologists in the country. As of today, I think we have less than 20 qualified periodontologists, although yes, we have quite a lot of residents, maybe about 20, 38, and the population of the country is about 150 million, which means you have less than 20 periodontologists catering for a population of over 150 million. That is quite ridiculous.